It's more than a case, it's personal.
The doctors, plural, are in this morning. Dr. Jeremy and Jermaine Hogstrom are back on the show. They, of course, are part of CHI Memorial's internal medicine practice. Good to see you both.
Good to see you again.
You're happy to be in our air-conditioned studio because it's hot outside.
Absolutely.
And you thought you'd take that heat as kind of the topic today because for people who have especially type 2 diabetes, is that right?
Yes.
This can be a particularly difficult time.
It is, and it's one of the things that we don't talk about very much. So we talk about diabetes, but we never talk about how to manage it, especially during the heat waves. And one thing that comes to mind is dehydration. So with diabetes, especially when you have a state of really elevated blood sugars, that can really predispose you to dehydration because your body is essentially trying to get rid of that excess sugar. And when it does that, you're losing water, which will lead to dehydration, heat exhaustion, and ultimately a trip to the hospital.
Okay, so let me pause you a second because you mentioned excess sugar.
Yep.
But when you think about dehydration, often people think about taking things like Powerades and that type of thing. But in this particular case, that would work against you, right? You don't want the sugars of a Powerade, or do you?
Correct. So whenever we talk about staying hydrated, a lot of people's natural reaction is, well, I'll grab a Powerade, Gatorade, or whatever sports drink that's out there. The only problem with that is that they are loaded in sugar because, you know, in all essence, when they were initially developed, they were developed for like high-level pro athletes. Most of us probably don't reach that level, but especially when you have diabetes, you're packing in more sugar, and again, the body's natural response is to expel that sugar by causing you to urinate more, which leads to more dehydration.
Okay, so is the dehydration the only concern that the heat brings, or are there others?
Well, so with the heat, it can lead to increased absorption of insulin. So many patients with diabetes will take their insulin. Well, when this happens, this can also lead to low blood sugars. So also, keeping a close eye on your blood sugars even more frequently during the hot days is also very, very important.
It gets confusing, doesn't it? Because the beginning comment was how you don't want to have too much sugar in your body, but then you followed it up by saying that with the insulin, it can cause low blood sugar.
Correct. So
finding that total seesaw balance is a real struggle. It's got to be.
Yep. It can be, and the thing with diabetes is that again, it kind of goes back to this. We often call it a microvascular disease because it affects even the smallest vessels of our body. And so when you affect those small blood vessels, it even affects the blood supply to the nerves. And with that, that can also lead to more difficulty, with the body's self-regulation of cooling itself down in those heated in environments, again, which increase that risk.
So is one of the reasons why you're focusing, it sounds like anyway, on the type 2 diabetic out there a little bit more than the type 1, is it because with type 2 diabetes, so much of what you choose to do with your life can really directly impact the disease, like the foods and fruits and vegetables that you eat?
Correct. And these tips can also be applied to type 1 because we can have very similar effects, especially in the heat. But our type 2s are what we see in an outpatient more frequently.
Explain the difference, because type 2 can be reversible where type 1 cannot?
Right, so type 1 is more autoimmune. So basically your pancreas is not actually producing insulin because it has an autoimmune. Your body basically has attacked the pancreas so much so that it basically produces no insulin at all. With type 2, it's oftentimes seen as more environmental. Oftentimes, risk factors, whether it's diet, whether it's your environment, whether it's obesity, do oftentimes play a factor, right? But type 2 can get to a point where you do become insulin dependent over time once your pancreas essentially burns out, which it can after a while of having to overproduce so much insulin.
So the kids are about to head back to school very shortly, and it's going to be hot when those school bells ring. Yep. I think there's still a pretty large percentage of young people today struggling with type 2 diabetes, so it's important to make sure that they're having the proper lunch and drinking a lot of water?
Absolutely. If you have any kids with diabetes, make sure they're staying hydrated. If they're outside on the playground, make sure they're taking those times to at least get off into the shade, maybe even go back inside to cool down.
Is there a best breakfast to eat in the morning? Like, should you eat a protein-packed breakfast? Should you eat a high-carb breakfast? What's the right thing to do?
Right. So often a mix of, You don't want anything that's going to spike your sugars in the morning. So ideally, opt for a more savory breakfast, so one that is more protein filled. If you're going to go for a carbohydrate, ideally a more complex carbohydrate.
Like
so
oatmeal?
Like oatmeal. Ideally, you know, maybe a handful of like fruit, not a whole bunch of it, because again, complex carbohydrates take a longer time to break down in the body versus a tall glass of orange juice or apple juice, which as soon as you drink that, your sugars are going to go through the roof. So
I know that y'all are
avoid
taking
that.
new patients. So for anybody who's watching, I mean, it's internal medicine. So it's everything that affects your life is what they're going to help you with. This just happened to be the topic today, but education is a big part of it. You like to spend time with your patients once they're there.
Yes, absolutely.
All
Absolutely.
right. Well, here's how you can become on that patient list. Their names, Dr. Jeremy and Jermaine Hogstrom. They are twins, but they share very well. So no matter who you get the appointment with, they will be happy to help you. Part of CHI Memorial's Internal Medicine Associates. 875-0999 is their phone number, and we do have to give a shout out to Jeremy because he just got married. Congratulations.
Thank you.
Are you clothes taking 2 or more cycles to dry? New dryer manuals recommend dryer vent cleanings annually. Call now and have a better running, more efficient dryer by the weekend. Call today